What does informed consent for auvelity look like? My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I'm going through a series where each day I talk about one of the most commonly prescribed psychiatric medications and how I would go through an informed consent process with one of my patients. Now, today I'm going through a medication that is not as commonly prescribed. It's called auvelity. It's relatively new, came out about 3 years ago. And it's actually not one that I've personally prescribed, but I have had patients who have taken it. So this medication is a combination of Wellbutrin or bupropion and dextromethorphan, otherwise known as cough syrup. So it uses a pretty common dosage of the Wellbutrin and a pretty low dosage of dextromethorphan. Now, for context, it's important to keep in mind that dextromethorphan is potentially something that people can abuse. So dextromethorphan can be taken in excess, and at lower doses, it acts as a stimulant, whereas at higher doses, it can result in agitation, violent behavior, psychosis, and liver damage. So the doses that are used in this formulation are relatively low. So for reference, when dextromethorphan is used for cough syrup purposes, it's usually dosed at 10 to 20 milligrams, whereas in auvelity, it's dosed at 45 milligrams. So it is higher than what you would use for a cough. But when we're talking about doses of abuse, we're talking about hundreds of milligrams. So why are they putting it in an antidepressant? Well, this medication acts by a novel mechanism. So of course it acts by the bupropion mechanism, which is a norepinephrine and serotonin reuptake inhibitor. We've talked about that in another video. And then the dextromethorphan actually acts as an NMDA antagonist. And so it basically calms down one of our more excitatory and potentially neurotoxic transmitters. This is the same mechanism that ketamine works by, which is now FDA approved for severe depression and suicidal ideation. One of the benefits of this medication, likely due to this novel mechanism, is that the therapeutic effect of this medication on mood can be felt pretty quickly within days, as opposed to other antidepressants that may take weeks to even months to have an effect. As far as side effects, this is going to have all of the side effects of bupropion, so decreased appetite, insomnia, anxiety, agitation, headache, GI upset, lowered seizure threshold. It also can cause things like dry mouth, diarrhea, sedation, fatigue, and excessive sweating. Blood pressure needs to be monitored when taking this medication because it can cause an increase in blood pressure. I would say the main thing that we might be concerned about with this medication is, one, the psychiatric side effects. You want to make sure that the person's not developing any psychotic symptoms or agitation or mania. But then there's also the concern of potential abuse, right? Because we know the dextromethorphan can be taken in excess to elicit a high. So potentially if someone took excessive auvelity in order to get that experience, it could be dangerous, especially because then the bupropion dose would be at a dangerous level. The withdrawal symptoms would probably be pretty similar to bupropion. However, I don't think we really know enough about the dextromethorphan to know what withdrawal from that might look like. So if you have any experience with auvelity and want to share either how it affected your mental health condition or if you experience side effects from it, then I'd love to hear about it. So please share in the comments below. And if there's another medication that you want to hear me go through informed consent on, then please put it in the comments and I'll try to get to it. Wishing you all good mental health, and I'll see you in the next one.